Good afternoon. My name is Nancy Spence, and I'm completing my bachelor's degree in clinical laboratory science at Winston-Salem University in Winston-Salem, North Carolina. I would like to thank you for the opportunity and the privilege to be able to speak to you about a subject that is important to me and crucial for the health of an entire city. The purpose of this study is to determine the possibility of using the quantiferin TB golden tube test for the diagnosis of tuberculosis infection rather than the traditional tuberculosis skin test, which is known as TST, for the Burmese refugee population in Fort Wayne, Indiana. The Burmese population has been shown to have a 40% rate of positive TB test with the traditional skin testing. The question that is of concern is if this high percentage of positives is due to false positive TST testing due to the prior BCG vaccination that was done in their home country, or is it a valid number of infections? In the United States, the Burmese have predominantly settled in just a few cities. There is a high incidence of active TB in the Burmese population who have been in America less than a year. 13% of the Burmese refugees have settled and made their home in Fort Wayne, Indiana. The health department in Fort Wayne has stated that 40% of the Burmese refugees have latent tuberculosis, and if these patients are not tested and treated with a year of daily preventative medications and followed up, that 10 to 15% would progress to active tuberculosis. It is imperative that these cases be discovered quickly because the Burmese are such a high-risk population and they need specific and they need cultural-centered counseling. There are many challenges for these people, and this is only one of them. It is proposed in this study that rather than the traditional TST skin testing that has been given through the past years, that a study of the quantiferin TB gold test be initiated to see if it would yield more favorable results in detecting and treating those individuals with latent tuberculosis. Many studies have been done in this country and in others in healthcare settings and in nursing homes that have proven the validity of using the quantiferin gold testing. The continuing goal of the Fort Wayne Burmese Refugee TB program is to diagnose individuals quickly and begin treatment as soon as possible. I have come to know some of these Burmese individuals, and they are a quiet and a beautiful group of people with a great desire to make a successful life for themselves and for their families in this new city and in this new country. They have many challenges in front of them to accomplish this. One is that with the traditional skin testing, there is a visit required for the inoculation of the skin test and then a visit for a follow-up for the test to be read. There are a large percentage of Burmese that will not return for evaluation and therapy because of the possibility of having the disease and the cultural stigma that is associated with that. There is also a problem of transportation among the immigrants. The proposed quantiferin test is a more appropriate test because there is one interaction with a blood draw and no necessary return visits to read the test. The test is not affected by the BCG vaccination and will reveal the true positives for latent TB. In this methodology, there is to be a group of qualified individuals who will test the Burmese group with both QFT, IT, the quantiferin test, and with the TST, which is the traditional skin test. Comparisons and statistical information will be derived, and it should show that the QFT is more effective at finding those that are positive for TB, and therefore it will allow treatment and protection of other family members and for the public. The objective: to determine if TB would be diagnosed and treated more efficiently with quantiferin than with TST by testing each participant in the study by both these methods. The procedure: prior to the TST test, each participant will have 3 tubes of blood drawn for the QFT testing. The TST test will then be performed on the forearm. Testing: according to the procedure, the quantiferin test will be run and results measured and analyzed. For the TST follow-up, After 72 hours, each participant's TST will be measured and evaluated. There will be a conference afterward for explanation of results and counseling if treatments are necessary. In the paired positive tests, there will be cases that are TST positive and QFT negative. These tests will be considered to be false positives due to BCG vaccine reactions or possibly due to non-tuberculosis mycobacterium infection and reactivity. Sensitivity and specificity will be calculated. This study is expected to reveal a greater sensitivity and an equal specificity for the QFT-TB test versus the TST test. The conclusions in this study should correspond with the studies done previously. The QFT quantiferin test is a valid choice to screen incoming refugees for the possibility of latent tuberculosis. Though this test is more expensive, it requires less healthcare hours and is more predictive of true positive latent cases. Thus, it saves money in needless preventative treatments. The QFT is quantitative and has resulting values in universal measurements. This test can be used in any state, in any country, and the values will be understood by all medical personnel. The TST skin test itself is very subjective, and the results can vary among healthcare workers who read the results. With the QFT, there is less bias and less error. As mentioned in the introduction, it is important to ensure compliance in testing with each patient, and there have been problems in the past of individuals who have received the TST skin testing and have not returned in the 48 to 72 hour window for the test to be read. With the QFT quantiferin test, there is only one visit with results within 2 days. Using the QFT would help lighten the workload of the healthcare system and identify immediately those patients at risk for tuberculosis, thereby decreasing the potential for active cases. Since TB is a disease that still represents over 2 million deaths and is one of the most prevalent causes of infectious fatalities in the world, I conclude that the quantiferin test would go a long way in assuring that those exposed to tuberculosis and those infected with tuberculosis would receive immediate and necessary treatment. Thank you again for allowing me to present my proposal. This proposal is very important to the health care of this nation. I appreciate your attention and your time. Thank you.